Ginger has been praised as a superfood for thousands of years. It calms an upset stomach. It fights inflammation. It even helps with nausea. Doctors recommend it. Health gurus swear by it. Your grandmother probably told you to drink ginger tea when you were feeling under the weather, so you would think eating more of it could only be a good thing, right? Well, not exactly. For most people, ginger is perfectly safe in normal amounts, like what you would add to a stir-fry or a cup of tea. But if you have certain health conditions, this popular root could actually make things worse. In some cases, much worse. Today, we are breaking down 5 health issues where you might want to think twice before reaching for that ginger supplement or brewing another cup of ginger tea. Some of these might genuinely surprise you. Let's get into it. Number 1. Bleeding disorders or blood thinner medications. This one is serious, so let's start here. Ginger contains natural compounds that can thin your blood by interfering with the way it clots. For most healthy people, this is not a problem. But if you already have a bleeding disorder like hemophilia, or if you are taking anticoagulant medications such as warfarin, aspirin, heparin, or clopidogrel, adding ginger could put you at real risk. These blood-thinning medications are carefully dosed to keep your blood from clotting too easily. When you consume ginger, especially in larger amounts like supplements or concentrated extracts, you are essentially doubling down on the blood-thinning effect. This can increase your risk of bruising, excessive bleeding, or in serious cases, internal bleeding. Over 60 drug interactions have been reported with ginger, and many of these involve anticoagulants and pain medications. That is not a small number. If you have surgery scheduled, doctors recommend stopping ginger consumption at least 2 weeks beforehand. The blood-thinning effect can cause extra bleeding during and after the procedure. So if you are on any blood-thinning medication, talk to your healthcare provider before consuming ginger regularly. What seems like a harmless cup of ginger tea could be interfering with your treatment in ways you never expected. Your gallbladder is a small organ that stores bile, a digestive fluid produced by your liver that helps break down fats. When you have gallstones, small hardened deposits form inside this organ, and they can range from being completely unnoticeable to causing severe pain. Here's where ginger becomes a problem. Ginger is a cholagogue, which means it stimulates bile production in the liver and increases contractions in the bile duct. For someone with a healthy gallbladder, this is not an issue. But if you have gallstones sitting in your gallbladder or bile duct, those increased contractions can cause a stone to shift and get stuck. When a gallstone blocks your bile duct, it can cause intense pain in your upper right abdomen, nausea, jaundice, and in severe cases, it becomes a medical emergency requiring immediate surgery. A blocked bile duct can even be life-threatening if left untreated. So while ginger might help some digestive issues, if you have been diagnosed with gallstones or gallbladder disease, it is wise to avoid large amounts of ginger. Small quantities in food are generally considered safe, up to about 4 grams per day, but high-dose supplements are a different story. When in doubt, check with your doctor before making ginger a regular part of your routine. Number 3. Chronic acid reflux or gastroesophageal reflux disease, commonly known as GERD. This one might seem counterintuitive because ginger is often recommended for digestive issues. And in small doses, it can actually help with occasional heartburn by speeding up the rate at which food leaves your stomach. But here's the catch. If you consume more than about 4 grams of ginger in a 24-hour period, it can actually backfire, especially if you already have gastroesophageal reflux disease, commonly known as GERD. Research has shown that higher doses of ginger may relax the lower esophageal sphincter. That is the muscular valve between your stomach and your esophagus that keeps stomach acid where it belongs. When this sphincter relaxes too much, acid can flow back up into your esophagus, causing that familiar burning sensation in your chest. Some studies report that people with existing inflammatory conditions of the digestive tract experienced worsened heartburn, stomach upset, and gastrointestinal discomfort when consuming concentrated ginger or ginger supplements. So if you are dealing with chronic acid reflux, that daily ginger tea habit might be making your symptoms worse, not better. Stick to very small amounts, a quarter teaspoon of fresh ginger in cooking here and there, rather than concentrated supplements or multiple cups of strong ginger tea throughout the day. And definitely avoid ginger ale if you are looking for relief. Most commercial ginger ales contain very little actual ginger, sometimes less than 0.25%, and the carbonation can actually make reflux worse by increasing pressure in your stomach. Number 4. Diabetes while taking blood sugar medication. Ginger has shown promise in some studies for helping regulate blood sugar levels. Sounds like a good thing for people with diabetes, right? Well, it depends. If you are managing your diabetes through diet alone, moderate ginger consumption may actually offer some benefits. But if you are taking prescription medications to control your blood sugar, such as insulin or oral diabetes drugs, ginger can create a dangerous situation. Here is why. Both your medication and the ginger are working to lower your blood sugar. When combined, they can cause your blood sugar to drop too low, a condition called hypoglycemia. Symptoms of hypoglycemia include shakiness, confusion, dizziness, sweating, rapid heartbeat, and in severe cases, it can lead to unconsciousness. This interaction is especially concerning because many people do not realize ginger can affect blood sugar at all. They might be taking a ginger supplement for joint pain or nausea, completely unaware that it is interfering with their diabetes management. If you have diabetes and want to incorporate ginger into your diet, talk to your doctor first. They may need to adjust your medication dosage or help you monitor your blood sugar more closely to make sure you stay in a safe range. Number 5. Low blood pressure. Blood pressure that's too low might not sound like a big deal compared to high blood pressure, but it can cause its own set of problems, including dizziness, fainting, fatigue, and in severe cases, shock. Ginger has been shown in some clinical studies to have a mild blood pressure lowering effect. For people with normal or high blood pressure, this might actually be beneficial. But if your blood pressure already runs on the low side, ginger could push it even lower. The symptoms of low blood pressure can be subtle at first, feeling lightheaded when you stand up too quickly or experiencing unexplained fatigue. Over time, chronically low blood pressure can affect blood flow to your vital organs, and that can become a serious health concern. This is especially important for older adults, who are more prone to blood pressure fluctuations and may already be taking multiple medications. If you are already managing low blood pressure, or if you are taking medications designed to lower your blood pressure, be cautious with ginger. This is another case where what works well for most people might not be the best choice for you. Some important things to keep in mind. Now, before you go throwing out every piece of ginger in your kitchen, let us put this in perspective. For the vast majority of people, ginger in normal food amounts, up to about 4 grams per day, is completely safe and may even offer health benefits. The problems we have discussed today tend to arise with higher doses, concentrated supplements, or extracts. The key is knowing your own health situation. If you have any of the conditions we have discussed, or if you are taking medications that might interact with ginger, it is worth having a conversation with your healthcare provider. Also, if you experience any unusual symptoms after consuming ginger, such as excessive bleeding, severe stomach pain, heart palpitations, or significant drops in blood sugar, stop using it and consult a medical professional right away. Ginger has been used medicinally for over 5,000 years, and there is good reason for that. It genuinely does have anti-inflammatory, antioxidant, and digestive benefits for many people. But like any powerful substance, it is not one size fits all. Being informed is the first step to using any food or supplement safely. Now you know the conditions where caution is warranted, and you can make better decisions for your own health. This channel is all about sharing useful, common-sense tips that help you stop wasting things and stretch your money further. We post many more ideas like this, so if you find these videos helpful, subscribe and stay up to date. Your wallet will thank you.